Intermittent fasting has become one of the most talked about lifestyle trends in recent years, widely promoted for weight loss, metabolic health, longevity, and overall well-being. But one of the most important questions many people rarely ask is how intermittent fasting actually affects the heart itself, particularly the cardiac muscle and its ability to repair, regenerate, and maintain healthy function over time. Because the heart is not simply another muscle in the body that can be treated casually with extreme dietary patterns. Rather, it is a constantly working organ that beats more than 100,000 times a day, circulating oxygen and nutrients to every cell, which means its energy demands, recovery patterns, and metabolic needs are unique and must be respected. And when people introduce intermittent fasting into their lifestyle, they are fundamentally changing the way their body processes energy, regulates hormones, manages inflammation, and performs cellular maintenance, all of which can influence cardiovascular health either positively or negatively depending on how fasting is practiced, the overall nutritional quality of the diet, the individual's health status, and whether the body is under stress from illness, surgery, or chronic disease. So to understand the relationship between intermittent fasting and cardiac muscle repair, it is important first to understand what actually happens inside the body during fasting periods. Because when a person stops eating for several hours, the body gradually transitions from using glucose as its primary fuel source to using stored fat and other energy pathways. Insulin levels begin to decrease, metabolic processes shift toward improved fat utilization, and certain cellular repair mechanisms may become more active, including processes that help remove damaged cellular components, which in theory could support healthier tissues throughout the body, including the cardiovascular system. But the heart's response to these metabolic shifts is complex, because cardiac muscle cells rely heavily on a constant supply of energy, and although the heart is capable of using multiple fuel sources such as fatty acids, glucose, and ketones, sudden or poorly managed changes in nutritional intake can influence blood pressure stability, electrolyte balance, and overall cardiac workload, which is why intermittent fasting must always be approached thoughtfully rather than impulsively, especially in individuals who already have cardiovascular conditions. One of the most widely discussed potential benefits of intermittent fasting is its ability to improve metabolic efficiency, and this matters greatly for heart health because metabolic disorders such as obesity, insulin resistance, type 2 diabetes, and chronic inflammation are among the most powerful drivers of cardiovascular disease worldwide. When insulin levels remain chronically elevated due to constant eating or excessive refined carbohydrate intake, the body may gradually lose its ability to regulate blood sugar efficiently, leading to metabolic stress that damages blood vessels, increases plaque formation, and forces the heart to work harder to maintain circulation. Intermittent fasting can sometimes help restore a healthier metabolic rhythm by giving the body periods of rest from digestion, allowing insulin levels to decrease and encouraging the body to use stored energy more effectively, which may reduce fat accumulation around organs and improve blood sugar regulation. And when these metabolic improvements occur gradually and safely, they may indirectly support the health of the cardiac muscle by reducing strain on the heart and improving vascular function throughout the body. Another mechanism through which fasting may influence cardiac health is inflammation reduction, because chronic low-grade inflammation is one of the silent drivers of heart disease, contributing to plaque buildup in arteries, stiffening of blood vessels, and impaired circulation. Certain patterns of controlled fasting have been associated with reductions in inflammatory markers, which could potentially create a more favorable environment for cardiovascular repair and maintenance. However, this benefit depends heavily on what happens during the eating window, because fasting alone cannot compensate for a diet high in processed foods, excessive salt, unhealthy fats, and refined sugars, which means individuals practicing intermittent fasting must still focus on consuming balanced meals rich in vegetables, lean proteins, healthy fats, whole grains, and micronutrients that support heart function. including potassium, magnesium, antioxidants, and omega-3 fatty acids, all of which play essential roles in maintaining healthy blood vessels and supporting cardiac muscle efficiency. Hydration also becomes critically important during fasting practices because dehydration can lead to fluctuations in blood pressure, increased heart rate, and electrolyte imbalances that may place unnecessary stress on the cardiovascular system, especially in older adults or individuals taking medications for blood pressure or heart rhythm disorders, which is why anyone considering intermittent fasting must ensure they are drinking sufficient water during non-fasting hours and maintaining balanced electrolyte intake. Another interesting area of research involves cellular repair processes sometimes associated with fasting periods, during which the body may increase activity in mechanisms that help remove damaged proteins and cellular components, a process that contributes to overall cellular health and longevity. While this concept has attracted significant interest in the context of aging and metabolic health, it is important to remember that the heart already possesses highly specialized systems for maintaining its function. And these systems rely not only on fasting periods but also on adequate nutrition, oxygen delivery, circulation, and hormonal balance, meaning that prolonged or aggressive fasting could potentially deprive the body of nutrients necessary for tissue repair, particularly in individuals recovering from illness, injury, or surgery, and this becomes especially relevant when discussing patients who have undergone cardiac procedures such as bypass surgery, valve repair, angioplasty, or heart attack recovery. Because during the healing phase following any major cardiac intervention, the body requires a steady supply of protein, vitamins, minerals, and calories to rebuild tissues, support immune function, and maintain stable energy levels. Therefore, strict or prolonged fasting is generally not recommended during the early stages of cardiac recovery, since the body needs consistent nourishment to repair surgical wounds, regenerate tissues, and stabilize cardiovascular function. Instead, patients recovering from heart surgery are typically advised to follow a structured dietary pattern focused on small, balanced meals that support healing while avoiding excessive strain on the digestive system or cardiovascular system. Once recovery has progressed and the individual has regained stability, certain forms of gentle time-restricted eating may be considered under medical supervision, but even then the approach must be individualized, gradual, and closely monitored to ensure it does not interfere with medications, blood pressure control, or energy requirements. Another aspect worth considering is the psychological and behavioral dimension of fasting, because lifestyle interventions are sustainable only when they align with a person's long-term habits, work schedules, stress levels, and nutritional needs. Some individuals find that intermittent fasting helps them reduce late-night snacking, regulate calorie intake, and improve dietary discipline, which can ultimately support healthier weight management and cardiovascular risk reduction, while others may experience fatigue, irritability, dizziness, or difficulty maintaining consistent nutrient intake, especially if fasting windows are excessively long or poorly planned, and when the body experiences frequent energy crashes or nutritional gaps. The cardiovascular system may respond with stress responses that increase heart rate, elevate stress hormones, and disrupt normal metabolic balance, which is why any fasting strategy should prioritize consistency, balance, and nutritional adequacy. Rather than extreme restriction, sleep patterns also play an important role in this equation because the body's hormonal cycles are closely tied to circadian rhythms, and eating patterns that align with natural daylight cycles may support better metabolic regulation compared with irregular meal timing late at night. Maintaining good sleep quality, managing stress levels, engaging in regular physical activity, and following medical advice regarding medications and checkups remain far more important determinants of heart health than any single dietary trend. Therefore, the conversation about intermittent fasting and cardiac muscle repair should always be framed within the broader context of overall cardiovascular lifestyle habits, which include maintaining a heart-friendly diet, controlling blood pressure, managing cholesterol levels, avoiding tobacco, limiting alcohol, staying physically active, maintaining a healthy body weight, and monitoring cardiovascular risk factors. Regularly, when these foundations are strong, the heart is better equipped to maintain its function, repair minor cellular damage, and adapt to metabolic changes over time. But when these foundations are neglected, no fasting pattern alone can compensate for unhealthy lifestyle habits that damage the cardiovascular system gradually over years or decades. Ultimately, the most important message for anyone considering intermittent fasting in relation to heart health is that the goal should not be extreme restriction or rapid results, but rather sustainable metabolic balance, because the heart thrives in an environment of stability, adequate nutrition, controlled stress, and consistent healthy habits. And by focusing on these principles, individuals can support not only the health of their cardiac muscle but also the long-term resilience of the entire cardiovascular system.